I really wanted to make the world a better place and help people, and so my career trajectory always went into the helping professions. From a young age, I think I've always been what I would say a community builder. If there was something that needed to be done, creating a new club or developing a new program, I would always want to bring people together and have this shared vision to move the community forward in whatever way that looked like. And that led me into helping professions, really wanting to improve not just individuals, but their families and their communities. So thinking back, it was March 2020 and the world got locked down. There was lots of therapists who closed down their clinics because they couldn't do inpatient care. And at the same time, there was tons of frontline staff working in grocery stores or health services that may not have had access to quality healthcare providers. And so what we wanted to do was really create this matchmaking system of trained therapists, experts in their field, and people who needed the support the most. And being able to bridge that gap across Canada so that people got access to 3 free sessions of quality therapy. And so that's exactly how we started with the emergency response team. But what we heard from therapists were the challenges of providing quality care in 3 sessions or less. That brief work really wasn't taught in their education. And so we developed professional training modules of how to build up the capacity within therapists to do brief work really well. And that training became the brief crisis therapy model and is now being integrated into clinics across North America. I think the challenge working in healthcare systems or social service sectors is that you don't necessarily get to determine your caseload. The caseload is depending on the demand of the people. So if more people need the service, your caseload grows. But when you're seeing so many patients in a day, you barely have time to eat, to take a breath between clients, and you're constantly in this state of catching up and frantic and busyness. And that mindset and that way of being may not bring the best therapist to the table either. So you may not feel that you're doing the best work that you could do because of how you're working in this system. So if the caseloads could be reduced and the more breathing space for the clinician could be provided, then people could really bring their best selves to the therapy sessions and feel like their work is making a difference. When you only use therapy here and there to get you through the rough times, it also builds this self-confidence where you know, I can get through this. I'm strong, I have the skill sets, I have everything I need within me to get through this. You might need a little help seeing it for the first little bit. But the idea of this transient approach to therapy means that it's telling the clients that they're capable. And I think that approach to therapy can be really helpful.